An annual exam or physical is time spent yearly with your doctor or clinician for an evaluation of general health and to make sure that you are up to date on your health care maintenance. You may review annual blood test results, be screened for depression or anxiety, visualize changes in the appearance of moles, and have various cancer screening tests. Medications will also be reviewed to make sure there are no contraindications or history of adverse reactions. Immunization records should be obtained, and the vaccines available for your age group should be discussed. This general exam will include a full body exam, which includes listening to your heart and lungs. If you have a chronic medical problem, your doctor or clinician may evaluate whether your treatment plan is working and make changes as appropriate. Women and men should both have exams annually. For a woman, this may include an annual exam with your primary care clinician as well as your gynecologist. At a traditional gynecologist, the evaluation would include a discussion of current women's health symptoms, such as breast pain, pelvic pain, period frequency, signs of infection, and intimate health. A pap smear for cervical cancer screening may be performed, as well as breast, speculum, and pelvic exams. A man may only need to see a primary care doctor or clinician. This person will begin prostate cancer screening at the appropriate interval, in addition to the general health screening already discussed. It is very important to form a relationship with your clinician before you get sick. They will be better able to care for you if they are familiar with your health history.